Okay, so this is the second video of the skull series. This is the same skull, but I've actually just taken off the calvaria. So now you can see the cranial fossa. And so this is where the brain would sit. Within the skull, you can see that there's this, so this is the cranial cavity. And so the cranial cavity is divided into the anterior cranial fossa, the middle cranial fossa, and the posterior cranial fossa. There are 12 pairs of cranial nerves that we need to consider when we discuss the internal features and the openings of the skull, because through those openings, these cranial nerves travel. So it's easier to actually learn the cranial nerves and which ones go through which opening alongside of learning the skull. It's just makes things a little bit easier. So the anterior cranial fossa is made up of the frontal bone and part of the sphenoid bone. So actually this is the lesser wing of the sphenoid bone. This part is the ethmoid bone, and these are the cribriform plates of the ethmoid bone. And in a natural skull, they would have little holes through which the olfactory nerve or olfactory axons would travel through. So cranial nerve 1 would travel through these openings. This little lip or projection in the midline is the crista galli. So as I said, this is the sphenoid bone. This is the lesser wing of the sphenoid bone. And now you're already in the middle cranial fossa. This is the greater wing of the sphenoid bone. And I'm going to talk about the projections and the bony features, and then I'll talk about the openings. These are the anterior clinoid processes, the posterior clinoid processes. This area is called the sella turcica, or the Turkish saddle, and this is the hypophyseal fossa in which the pituitary gland sits. So there are some holes here that we need to consider. This is the optic canal through which the optic nerve, the second cranial nerve, travels through. So you see there are two, because there are two optic nerves, so there's a pair of cranial nerves. This is the superior orbital fissure that we looked at from the frontal view of the skull. Superior orbital fissure transmits cranial nerve 3, or oculomotor, 4, or trochlear, 6, or abducens, and the first branch of the trigeminal nerve, or ophthalmic. So 3, 4, 6, and 5, 1 travel through the superior orbital fissure. Then this opening here is foramen rotundum. Foramen rotundum. Through foramen rotundum travels the maxillary nerve, or the second branch of trigeminal nerve. And then this opening on this side, and I'll show you on this side as well, this is foramen ovale, so kind of oval shaped, transmits the trigeminal nerve branch 3, mandibular nerve, or mandibular division of trigeminal nerve. Just posterior to that, you see foramen spinosum, and that transmits the middle meningeal artery. Okay, so now we're in the posterior cranial fossa, and before I move on to the posterior cranial fossa, I want to mention this part of the temporal bone. So remember, we talked about the temporal bone and we looked at it from the outside. The temporal bone has this hard portion that's called the petrous ridge of temporal bone, and just underneath it you should be able to see in the natural skull the middle ear and the inner ear features. So this is the petrous ridge, and this is actually the border between the middle cranial fossa and the posterior cranial fossa. This hole, now we're in the posterior cranial fossa, is the internal acoustic meatus, or internal auditory canal, transmits the 7th and 8th cranial nerves, facial nerve and vestibulocochlear. Now we're clearly in the posterior cranial fossa, and this is the occipital bone. This opening is the jugular foramen that transmits cranial 9, 10, and 11. Cranial 9 is glossopharyngeal. Cranial 10 is vagus. Cranial nerve 11 is accessory. This opening is foramen magnum that transmits arteries as well as the spinal cord. So one of the arteries that travels up through this opening is the vertebral arteries, but it also transmits the spinal cord. So the spinal cord lies in here. And then there's an opening here, and that's the hypoglossal canal that transmits the hypoglossal nerve, which is the 12th cranial nerve. Let me go back to the middle cranial fossa and just mention this opening. This is foramen lacerum. In life, there's actually cartilage blocking the inferior view of foramen lacerum. So really nothing goes through this opening, foramen lacerum.